And welcome back to Stories from the River. This is your host, Charlie Malouf, and I am here as part 2 of our 3-part conversation with Dr. Timothy Nelson from HeartWorks. Tim, welcome back.
Thanks, Charlie. Great to be here.
All right, let's get back into it.
Welcome to Stories from the River, a show in which we go behind the scenes at Broad River Retail.
HeartWorks today, you did a great job on the first. If you haven't seen the first episode and you want to know about how we got here with HeartWorks, go back and check that one out. And in this conversation, Tim, HeartWorks has so much going on right now, and it's moving at it's taking massive action, moving at like Mach speed. Tell us about HeartWorks today.
Yeah, so HeartWorks today, we build hearts. Our website is literally webuildhearts.org.
That's cool.
So it's pretty clear what we do, right? And it's a team approach to be able to take the science out of the lab, get products, and start treating patients with heart failure. So HeartWorks is really today focused on being the first in the world to have FDA approval to use autologous heart transplant. And what I mean by that,
say it one more time.
Autologous heart transplant is we're the first in the world to have FDA approval to do this procedure.
What is an autologous?
Autologous. So what autologous means is it's from your own body versus allogeneic, which is all heart transplants.
Okay.
Heart transplants come from somebody else into your body. You have to take immunosuppression drugs. What HeartWorks is perfecting is the process of manufacturing your cells into your beating heart tissue. And it's genetically identical to you. So when we transplant that back into your body doesn't reject it. Right?
That theoretically and practically.
Exactly. So nobody's done this in the world. This technology is now available, and HeartWorks has gotten the approval to do what nobody's ever done before, which is to use an autologous heart transplant. We make your heart in the lab and we transplant that back into your heart to make it better.
How challenging was it to get that approval?
Yeah, so we've been working on this technology for 10 years.
Mm-hmm.
This is a massive problem and challenge, right? This is a 9-month manufacturing process. 9 months, the raw materials come in the front door. 9 months later, the final product goes out the back door to be used to treat a patient. Just to do the manufacturing has been a decade nearly of work of scaling it up. We now do it not in the research lab where I started in a small scale under a microscope. We now produce 3 billion cardiomyocytes, or heart muscle cells. Give you a reference, your heart as a normal heart, Charlie, will have about 4 billion cardiomyocytes in it, the whole heart. We're now manufacturing this at scale to produce 3 billion. So 3/4 of your heart we produce in one run in this 9-month run.
Okay.
So now these cells are available. They're your cells ready to be treated. We now have the FDA permission to actually do the clinical trial where we inject those cells back into a patient's failing heart muscle. So all of that is what has really been the intense focus of the last 5 years to be able to get to this point. And what's important to realize is that we're leading the globe on this right now, right? The effort of Todd and Karen and the Ashley organization and the investment of multiple donors across the country and world is what has allowed us to create a world-class team, and we're leading the world, first in the world to do this transformative technology.
webuildhearts.org. And have you done this, or can you give us some success stories?
Yeah.
Of just some of the patients that you've worked with?
Yeah. So, this journey, you got to find pathfinders is what we call them, right? This is such a massive problem. I mean, this is like going to the moon. Like, you're going to sit down and say, okay, let's rebuild somebody's heart. Let's do this, squirt this in there, do that, right? I mean, it's a massive problem from all the complexities of the patients, the regulatory, the hospitals, I mean, all of these complexities. So we actually started 10 years ago is we started using a different cell from umbilical cord blood.
Mm-hmm.
So we collect cells from the umbilical cord blood and we use those in clinical trials. And so we've had a series of Pathfinder projects where we've treated hundreds of patients with lower risk products that are easier to manufacture to get all the pieces in place. All of that has set us up to now be the world's first to do the autologous heart transplant. So in that journey, a couple success stories. We've used actually bone marrow out of patients' own body to rebuild their hearts as well.
Really?
And so cord blood and bone marrow are kind of like fertilizers. They don't make heart muscle themselves. It's like fertilizer to grow the plants better. We put bone marrow and cord blood into your heart muscle to try to rejuvenate it and make it stronger on its own. That's the trials that we've had some impressive success stories. Jarrett was one story that came to us in heart failure, needed a valve replacement, but his heart was too weak. And so we used his own bone marrow cells. We were able to transplant that back into his heart. His heart actually got strong enough, healthy enough in that case that he could go under surgery and have a valve replacement. And now he's playing basketball, living his life fullest. And so those are some of the success stories where the right product at the right time can just be transformative for the outcomes.
And Jarrett's story was made possible because of the work that HeartWorks does.
100%. So this is the Pathfinder technology that we've worked on. Another success story is we've taken a skin biopsy from a couple that was 100 years old, literally 100 years old. We took a piece of their skin and we proved that we could reprogram and re-engineer their cells into these induced pluripotent starting material and make cardiac cells out of it. And when we did that, we learned that their cells reprogrammed are indistinguishable from a 3-month-old baby's cells that get reprogrammed. So think about this, Charlie. We're literally learning that we can reprogram, send your cells back in time and make them as young as anybody's, no matter what your chronological age is. This is mind-blowing.
That's
what's possible.
Massive ramifications, I can imagine.
100%.
So someone's got to see this. Well, I wore my shirt, believe, because can you believe the art of the possible?
Exactly right.
And you're making it what we like to say, the art of the actual.
Exactly.
Okay, those are a couple amazing stories. And so what is like the mission, vision, purpose of HeartWorks today?
Yeah, our purpose is to cure congenital heart disease. We build hearts to cure congenital heart disease. That's HeartWorks. We're a clinical stage nonprofit that is making that vision a reality. We come down to 5 things that we think a lot about as our team and our directors. The first is we're motivated by the urgency of congenital heart families. All these families live with the fear of what's tomorrow, the uncertainty. Those of us that don't have a child and that can't really understand it. So we put the patient first. That's our why, is the urgency of these CHD families. We also are motivated by transformative outcomes. We're not interested in incremental outcomes. We're saying we got to go for a transformative, a cure, a pathway to a cure is what we're talking about. Anything short of that is out of scope for us.
Which is going to require a lot of research and development. Because
Exactly.
in the first episode, you talked about like, we don't even know how most of these things occur. So like 5 to 20% are maybe genetic.
Right.
There's 80 to 95%, we don't know how it comes about.
But the final common pathway of heart failure is the same for people with congenital heart disease or even older people that have had a heart attack. And so when the heart muscle becomes weak, we don't have good options to treat weak heart muscles other than medications and hope that it doesn't get weaker. What we do, we build hearts. We're building hearts to literally rebuild the motor of the patient to make them a 5 horsepower, 10 horsepower, 50 horsepower.
That's cool.
Right? That's when we say transformative outcomes. We're saying we're going to go rebuild the heart to have a transformative outcome.
Okay. Yeah, I stopped you on, you're going into number 3. So the create urgency, the transformative outcomes.
The third one is we're undeterred by obstacles. We're going after a moonshot here, right? There's no way this is going to be a linear path. There's no way this is going to be simple. We got our butts kicked this year with some surprises with this next clinical trial. We weren't able to recruit as fast as we hoped. Lots of reasons we learned. We got our butts kicked. And so we had to go back to our basics. We had to reevaluate. We had to double down. But sometimes when that happens, you actually come up with a new idea that becomes transformative in what you do next. So we've got some ideas that we can share next about what we're doing on that front. The fourth is that we're committed to a shared responsibility here. This team of teams approach is we're really committed to making this synergistic and winnable for hospitals, for patients, bringing the community into an ecosystem that everybody wins. It's a platform. Like we don't have to control it. We want to inspire and motivate and align people. That's a defining feature. And then the final one is we're committed to a self-reliant ecosystem. And what I mean about that is this really unique structure of the nonprofit, for-profit working together. We can't rely on somebody else coming in and being the provider, the manufacturer, the distributor, because the market is too small. We have to do it ourselves. So being a self-reliant ecosystem, we're combining the nonprofit, for-profit, aligning the shareholders of both of these entities to have an aligned purpose of curing congenital heart disease. But maybe what we'll talk about next at some point, Charlie, is we're not just talking about congenital heart disease.
Mm-hmm.
This platform, this technology literally can be applied to anybody with heart failure. And that's where this gets even much, much bigger than what we're talking about today.
Yeah, we'll talk about that when we get into our future conversation in episode 3, small teaser. Really what we talk about at Broad River and what you're leading me to think about, Simon Sinek wrote a book called The Infinite Game.
Mm-hmm.
And there's finite thinking and infinite thinking. And everything that you're talking about is massive. It's transformational. It's undeterred. It's platform-based thinking and theory. And it's for, you're thinking long-term. You're thinking legacy, generational, and you're in it. As you told the story earlier, you're going to devote your life to it and it'll survive beyond your life. This technology, someone's got to do it. You took the first action to kind of go after this and you're moving first and you're moving fast. And there's going to be some stumble. It's not going to be all the way up and to the right. There's going to be some stumbles along the way.
Have you ever seen this diagram where they have a marble rolling down a ramp, and one ramp is just a straight linear path, and the other ramp is up and down like this? The marble goes up and down, but it starts in the same spot, it ends in the same spot. One's flat and one goes up and down. When you drop the marbles, which one gets to the end faster?
Well, based on what you're telling me, I would have assumed this one, but now I think it's probably this one.
You're a smart guy, aren't you? It's amazing to watch. You should do this. The ones that have an up and down actually accelerate through the down, get over the up and accelerate through the down, and they actually get to the finish line faster than the straight linear path. So we shouldn't be embarrassed or shy from the ups and downs.
Mm-hmm.
We got to leverage those. We got to build on those. And those are the moments that you really get creative thinking and a cross-functional team to do even more than what you thought you could do.
Absolutely. I mean, I love how you're budgeting for failure. You're planning for failure.
Exactly.
It's not winning or losing. It's winning and learning.
I love it.
Yeah, that's a Maxwell quote there. Okay, so you've talked about Ashley and Ashley's involvement, and we had an event last night. It's, I think, your 3rd annual virtual dinner, which I get to attend in person.
Yeah, it's awesome.
And so you've got Greg Olson involved, who has a son who, I think people who have children with CHD, they say they're a heart dad or a heart mom.
Exactly.
And so he has a son with a congenital heart disease. He's got a foundation around it too. So you got connected with Greg Olson. You did this virtual dinner. Ashley's involved. Take us through some of those threads and stories.
Yeah. So first, I want you to know, and all the people in your organization, that at Ashley, in the whole ecosystem of Ashley, that you all do a lot more than just building and selling furniture, right? And you know this, but I want to share what I think about what you all do. And with Todd's leadership and the whole Ashley organization, with the marketing, the communication, the bedroom giveaway that you were part of last night, you guys, because of what you do at Ashley, also build hearts. It's because of what you do and how you do it allows us to do what we do. And this is really the team of teams. And when people can see that in the bad days when we're having in any of our jobs, but there's a commonality that we're working together on to do something big and purposeful, it just gets us through those bad days, right? So Ashley has been a huge partner for us. And thank you for what you and Manny did last night and showed up at the event. Greg Olson, his son TJ, has the same condition that Todd and Karen's daughter Gabrielle has, and that's been our bond and our team of teams. And so, we brought together over 1,000 people last night on Zoom. We cooked a meal together,
It's amazing.
right? A live audience that you were part of. We cooked and ate together there. You watched kind of the Saturday Night Live show set.
That's right.
What do you think? Did you enjoy yourself?
It was phenomenal. It was phenomenal to be behind the camera. We were at Chef Alyssa's kitchen in South End. I think the first year you did it at Todd and Karen's house in St. Pete, and then last year at Greg Olson's house in South Carolina, and then here at in South End in Charlotte at Chef Alyssa's Kitchen. It's a world-class production, and it's great to kind of see the big screen with all the Zoom, everyone on Zoom engaging, and then the two families cooking and the chef and Greg interacting. It was a world-class production, and the food was phenomenal too.
I heard that. I heard the salmon was fantastic. So we send out Superior Fresh salmon that's grown in Atlantic Atlantic salmon raised in a farm with Karen Wanick's leadership, and we sent out over 600 boxes of food to people. They unpacked it, they cooked together, we ate a meal together, we shared our stories. People got to hear from the families. Many of them were in the hospital that can't get to an event. They all were able to log in on Zoom. So this is just a great way to build and earn the trust that we are trying to build as a community, right? We work for these families. This is why we do it. This is our urgency. And by giving people, everybody, an insider's view of what we do, how we do it, why we do it, it just builds a level of trust and camaraderie that really is critical for us to move even faster.
Yeah. At Broad River, our purpose, and Manny spoke about this, last night, is furnishing life's best memories.
Love it.
And, it's for others. But we, the work that you guys do enables families to have more and longer and best memories with their children and with each other. And so that's what it's all about. So for us, you're right, with Ashley, with Broad River, to find organizations doing powerful, life-changing work. We love to partner in the communities and with our neighbors. So once we found out that, Todd and Karen were behind this many years ago, we've loved supporting you. And I've known you for many years and the work that you're doing. I'm always inspired by the work that you're doing. And we love supporting the work that you're doing, and our people who get to kind of learn about it and either donate or cook a meal together or just kind of feel better about the work they do, because they know that the work that we do goes out to help in some way indirectly others in our community who need help. So that we get uplifted from that.
Charlie, you may not remember, but I reached out to Todd Wanick, 10 years ago when TJ Olson was born, and the news hit that, the tight end at the Carolina Panthers, Greg Olson, has a son with the same condition that we're working and studying. I'm like, man, we got to get connected with him and share our story. And so I called Todd Wanick, said, how do we get connected? Who do we go? And it was a half a millisecond of who he connected me with, and it was you. And you were the one here in South Carolina, North Carolina, that were able to connect us to Greg, and that was where it all started. And that story goes back probably almost 8-9 years ago.
Greg's been a good friend, and we've done some work with Beds for Kids, and then his Have a Heart Foundation at Levine Hospital. And so it was we were happy to make that. We had some mutual connections there. Happy to make that connection, and so he does a great job co-hosting this virtual dinner, and it was a really fun experience. Manny and I got to bring our wives last night and engage and meet some of your leadership council who was with you for the day yesterday as well. Yeah. So you've got just really smart people and major donors from all over the country who are, first person connected, met a gentleman whose son was back home and has CHD. And so and another one whose dad had it. And so they're coming together. And you want to talk about your leadership council for a bit?
Yeah. What's amazing to me is that none of these people actually, about one, have a personal connection to congenital heart disease on the leadership council. The story, the massive action, the purpose that we're putting together is a magnetic draw for people that want to do good and have an impact and really transform things. And we've built an investable team at HeartWorks that brings people to the table in many ways. Financial donors, yes, that drives us forward, but in partnerships, companies like Ashley with the bedroom giveaway, InfoTrust that has helped us do our IT redesign to be more search engine optimized. There's just a number of different partners that are coming together, providing their professional expertise to be able to amplify and rejuvenate what we can do. So that's what the Leadership Council is about thinking differently. It's not just writing a check. It's not just donations. It's all the other intangible things that really builds the trust, builds an ecosystem that is resilient and robust and can really build the confidence to be committed to the next big idea, right? And that's really what's exciting for us, is that, your courage to make the next decision is only dependent on the confidence from your previous track record. And when your track record is building in momentum, it gives you more courage to take on the next big thing.
Yeah.
And so that's really what this leadership council is doing and helping. And it's just fun to learn from people that are not physicians and scientists, and to bring the business community together, the legal people together, marketing people together. Boy, it gets a lot of fun when you get that group in the room.
Your passion is really contagious. I love the analogy of like, hey, when you fall off the bike, but you know that you can do it, you get back up, and that gives you that courage. We'll talk about courage and where we go from here in the next conversation. What does HeartWorks need today? What if someone wants to get involved or support the mission, the organization? What can people do?
Yeah, and I've never met a single person that can't help us. Okay, so every single person listening can help. The first thing anybody can do is connect us with any family that you know of congenital heart disease. They're out there. You know who they are. When you meet somebody, make sure they're connected to us, because we've got some tools and assets that really is important for them to be aware of. So connecting is step number one, right? The second thing is, obviously we take donations, and we take philanthropic contributions. There's no donation that we can't accept, from a DAF, a donor advised fund, to a personal check, to a foundation. So know that we are mission aligned, and we are really trying to find partners that are motivated for the long term to make transformative outcomes. And we'll talk a bit next time of what we really mean by that. And then the third thing is, people have professional skills, marketing, communications, networking. There's so many other skills that we don't even realize we need, that people often bring up. Well, have you thought about this? Have you thought about that? And so, team of teams. When we build a team of teams, it's about all of us thinking creatively and moving it together. But one thing we announced last night that's transformative is, we know about organ donors. We know about blood donors. We created a whole new movement last night with the co-op that we launched of data donors. And when we get people with congenital heart disease donating their data, we can now use that in AI and large language models to predict and identify who's going to be at risk, and then start designing new products for the highest need patients. So rather than waiting for people to show up, we're going to flip the script, and we're going to use the donated data that this community can share with HeartWorks, and we're going to design product development for the customer's needs, if you will, rather than building it and hoping they come. This is a fundamental game changer for biomedical research, and the co-op at HeartWorks was launched last night. Our goal is to get 50,000 people with congenital heart disease signed up for the co-op, and that will take 4x off of our timeline of what we do for clinical trials. So anybody that knows anybody with congenital heart disease, webuildhearts.org, sign up for the co-op and help us change the momentum of what we do.
I love that. Data donors.
Don't you love that?
Yeah. Anonymized aggregate information.
You got it.
Can 4x, exponentially speed up your solutions for being able to solve CHD at the base level.
And what's really exciting about this is, no hospital is large enough themselves to do that. Because HeartWorks, as a nonprofit trusted partner, can work across any hospital and bring people together. And if we can earn the trust with the patients themselves, patients own their medical record. Hospitals don't own it. Patients own it. And if you have a trusted partner like HeartWorks wants to be, you can donate your data to that entity, and that then becomes the catalyst to target, to give clarity and give focus on the products that need to be developed next. So I think this is going to be far beyond congenital heart disease. I think this has the potential of revolutionizing the way we do medical research.
Yeah, and you're going to be infusing AI into scrubbing through that data. Bio data. I'm wearing my Whoop bracelet band. Some people wear an Aura ring or an Apple Watch. We have all kinds of biometric data now. What kind of data are you trying to get donated here?
Yeah, we're starting out with really the medical record. So the data of the clinical record of history of surgeries, of cardiac imaging, all the stuff that is in the medical record, we're going to start with that. But you're 100% right. All of the wearable data is going to be added onto this as we build and grow it. So imagine having that repository We have a blood bank, if you will, right? That people donate blood. Imagine the data bank, the data donation that can come in a focused way like this. Just fundamentally changes the way you think about what's next.
That's powerful. Great segue to talk about what's next in our next and final episode of the HeartWorks story. We'll talk about the future. So thanks so much for joining us for part 2 of our conversation with Dr. Timothy Nelson from HeartWorks. Join us back next time for the conclusion of where we go from here. Thanks so much. Whether you're on YouTube, Apple, Spotify, thanks so much for joining us. See you next time.
Thanks for listening to Stories from the River. To check out more episodes, visit storiesfromtheriver.com. Join us again next week, and remember to like, rate, and subscribe to the podcast.